So welcome all of you to this session. Our key focus will be on crisis communication. Samuel, are you able to see my slides? Matut, are the slides visible?
Yes, it is clear.
Okay, that's okay. Now, welcome to this lecture on crisis communication. And this crisis communication is in the context of leading us to ensure proper reputation of our health organizations. So it is an important subject that we cannot afford to ignore. And it is very, very important for us that we have joined today. And the reason why we are doing this particular discussion here is to be able to understand how we can also manage and mitigate impacts of various health crises within health organizations. So we will begin by understanding the definition or the meaning of the term crisis. We are just saying it's an event or an issue that requires immediate action from the organization. So it's an event like any other. Now we will now be able to narrow down and look at various examples of these events to be able to understand them. And we are also interested in understanding that it's a strategic communication process, and the aim is to be able to manage and mitigate uh, the impacts of various crises in an organization. And the reason why we are doing this, we are also keen to maintain the public trust. We are also keen to ensure the well-being of patients, staff within the organization, and also any other stakeholder that would be interested in matters, whatever crisis that has arose within an organization. Um, Basically, examples of what we would call uh, crisis. We could talk about pandemics. We could have issues to do with disease outbreaks. Those could also be examples. We could also have issues to do with natural disasters. And now we are having conversations around the El Nino. Um, we have seen already in some parts of the world it has already started, and guys are experiencing floods. So what is our role in communicating during that particular kind of a period? And of course, we now have other kinds of emergencies that might arise. So it is an area that we cannot afford to ignore, because the key reason is for us to remain or to protect the image of our organization, ensure that our reputation has not been ruined, maybe because of misinformation, maybe because of lack of information, and maybe because we have not been able to set really time to communicate about this crisis and understand what really tell the public, tell the stakeholders on what really they need to do in the regards to this particular crisis. So when we discuss maybe the term reputation management, uh, we are talking about an organization's stake of perceptual and social assets, including the quality of stakeholder relationship. Perception, or what we are calling perceptual and social assets. Perception is all about what people that are, what are people thinking about the organization. If you ask somebody about the organization X, what is it that they are going to say about it? Is it a positive comment or it is a negative comment? Yeah, so the reputation aspect will only be safeguarded when we make sure that we are doing proper crisis communication. And we're also going ahead to say crisis can decrease the reputational capital depending on various factors. So depending on what level of crisis, what kind of crisis, it would lead us to a place where we are lowering the reputation of the organization. So it is something that we need to keep fighting to make sure that we are communicating right. And we also have the word stigmatization, where we are saying it's all about the perception of fundamental weaknesses that leads to repeated failures and crises, discrediting the organization. And also within the concepts of communication, we would also have the effects of what we call halo effects, where it's going to minimize the damages of the crisis to the corporate reputation. Now, when it comes to issues crisis, we have practical examples that we would call crisis. Maybe we could look at them and see how they were handled. A major one is, of course, the COVID-19 pandemic. That was a global pandemic. So in terms of communication, the WHO was very keen in terms of regular press conferences, issuing of public statements in regard to COVID-19, and also providing regular updates. And I'm sure different countries also at their level, they were also doing the same. They were doing regular communication. I don't know about your country, but I'm sure maybe it was also being done. So that is an example of a practical way on how communication was done during that particular period of COVID-19. And previously, we have had other outbreaks like the Ebola outbreak. The CDC, which is the Center for Disease Control, had collaborated with the local health authorities to always provide information to the public. We are going to see why that is important. Why don't we just keep quiet when we are in a crisis? Why don't we just keep quiet and let it fade away? If it's COVID, let it fade away without a lot of communication. We are going to understand the importance of communicating during crisis. We could also maybe think of, finally, we also had what we used to call Zika virus. This was happening in Latin America. So there was a spirited multimedia campaign to be able to raise awareness in regards to this virus. And the reason why we are doing all that is to let people know and be aware that we have this kind of a virus, and these are the ways that we can be able to protect ourselves from it. Now, why is this discussion very, very important? Why is it that we need to have crisis communication to ensure we manage our reputation? Those are a few points maybe that you could be able to note down so that you can also think about them. One very, very important reason why we are doing crisis communication to manage our reputation is to be able to ensure timely information dissemination. So we need to be very timely in giving the information, giving people an update of how many infections per day. That was very common during the COVID season. Every day we could get numbers on what was happening. So importance number one is about crisis communication, helping us to do timely information dissemination. And also the second one, we are able to reduce panic and anxiety. You know, during those particular periods, during these pandemics that I've just given examples, disease outbreaks, natural disasters, other forms of pandemics, people have anxiety. people have panicked. They do not know what exactly is going to happen. So crisis communication is key in ensuring that we reduce that panic and we reduce that anxiety. It is a way of telling the citizens, the community, the stakeholders that we are on this and we are following up on what is happening in this particular crisis. So it is very, very important to reduce panic and anxiety. The other thing, crisis communication to ensure reputation management is going to now, the third one, help us to build trust. It helps us to build trust with the communities. It helps us to build trust with the citizens. It helps us to build trust with all the citizens or all the stakeholders that are involved in that level of communication. Now, because of crisis communication, we can also be able to trigger behavioral change. We are able to trigger behavioral change. See, for example, during COVID, people changed in terms of regular washing of hands, in terms of wearing of masks, in terms of ensuring proper spacing within transport sector, and so on and so forth. If, of course, we were not in such kind of a crisis, even now when COVID faded away, people have gone back to their old ways of doing things. They are no longer washing hands. They are no longer wearing masks. Yeah, so it is very, very important at that particular point where we have a crisis to regularly communicate so that we can be able to trigger change. We can be able to things in order to safeguard themselves from the crisis. And also another very very important reason on why we do crisis communication is to be able to counter misinformation. During the period for COVID and other pandemics, of course, we had a lot of misinformation. So the only way to deal with that misinformation is to be able to communicate regularly, ensure ensure everybody is getting up to date information. Uh, some of this misinformation is dangerous to the community in relation to panic. Mm. I just saw some videos today on from India where they are experiencing floods and buildings were collapsing because of lots of water within the Indian environment. But from our end here, we may never say whether it's true or not. I have seen a lot of information, even during political campaigns. People will pull out videos that were done very long time ago. So somebody will just come up with a video for floods, edit it, and say that it is in South Sudan, it is in Kenya, and people are going to believe, and they are going to be fearing to live their lives as they have been living. So, based on this misinformation, with the current situation of social media, then we have a lot of misinformation every corner. Mm. So, the best thing is to come out and communicate during the crisis so that we can be able to counter this misinformation. And finally, crisis preparedness or communication is going to assist us to ensure we also do long-term preparation. From that particular season, then we can be able to learn on what we can do in the future in regards to any pandemic that might come up, and also be able to improve in future situations. So that is key for you to note. Uh, Timely information dissemination, reduced panic and anxiety, trust building, behavioral change. We are able to counter misinformation and also long-term preparedness. We have different types of healthcare crisis. Uh, we have different types of healthcare crisis. Now, number one is what we call medical errors or malpractices. Yeah, so what kind of situations are these? Is when the healthcare providers will cause harm or injury to the patients due to negligence, incompetence, and misconduct. So this is a situation that we could find ourselves in where errors have happened. They could happen during operation. I'm sure you have heard stories of operating tools that have been left inside a patient's body. And then we are, that's what we are calling surgical errors. Misdiagnosis, uh, you could misdiagnose somebody and you put them on drugs, and unfortunately, they may not be suffering from that particular disease. Yeah, so that's very key to be able to note. Um, the other kind of crisis is financial or legal scandals. So this happens in healthcare organizations that are involved in fraud, in corruption, embezzlement, or illegal or unethical activities. Um, so issues of fraud are very common, and some of them would go public. That means the reputation of your organization is at stake. If they are put on print media, on televisions, on radio stations, everybody will get to know your company, even if it was not really known. So that's a major crisis. Issues of embezzlement. Maybe you are receiving finances from donors. We could be able to have embezzlement where that money is being channeled to other activities. And also we have illegal and unethical activities. Now, we could be having unethical activities in the context that we could be having healthcare professionals that are not qualified. They just acquired some certificates from there, and they are serving people, and they are administering drugs. Those are unethical activities, and they are around us within healthcare organizations. Mm. And then also we have things to do with billing fraud, where people have colluded to produce a bigger bill than it's supposed to be. Kickbacks, very common also. Tax evasion, healthcare organizations avoiding to pay tax, and also we have things to do with data breaches. Now, other crises would be organizational or leadership failures. So we could have a problem within the leadership. They could be they are unable to meet their goals, their standards. We could experience an element of poor management, poor decision making within the organization. Um, Now, in terms of quality, we will talk about accreditation problems. Of course, for you to run these healthcare organizations and any other kind of organization, there are some form of accreditation that you need, and you are unable to get them, or you have not been able to get the accreditation. And then we also have staff turnover. Uh, we have staff turnover is all about Turnover is all about the movement of staff in and out of the organization. Uh, Uh, so yeah, so nobody, nobody wants to be in an organization where, or nobody wants to be engaged in an organization where there is staff turnover. Staff turnover, like I've said, it's all about the movement, yeah? The movement of staff from one. People will of course begin to make comments that in that organization employees do not stay. Maybe they would say that these guys don't pay their staff, and other reasons. They could be genuine or not. Yeah, so we could also have public relation blunders. This is interesting because yesterday we were talking about public relations. So we could have blunders in the context of some communications that we did that were not okay, and they have already gotten to the public. So they are going to put us into a lot of problems. We have other forms of crises is external threats or disasters. So these are situations where a healthcare organization is going to face sudden or unexpected events that disrupts its normal operations. So natural disasters, like now we are having conversations around the floods. We have talked about that. We had a very bad earthquake in Turkey, Morocco, just the other day. Issues to do with terrorist attacks. Those are external threats now. We do not have control over them, but they are likely to happen. Cyber attacks, with the advent of technology currently, the issues of cyber attacks have also become very common. And lastly, it's on pandemic or a number of pandemics. Yeah, so other examples of crises that maybe we could talk about, it could be shortages in critical medical supplies. Maybe we do not have enough medication within the healthcare organizations if they are hospital in nature. We could also have declining patient satisfaction, maybe from the research that you have done are the patient's comments are negative. They don't like the services that your organization is offering, or the percentages of the performance have reduced. That's a crisis also, and we need to know how to communicate that, get it out of the mind of patients, because they will go telling their friends that in that particular organization you may not be served well. So, and then of course we could have some issues to do with negative media scandals. We could be having stories that are running that may be correct or not. So it is due to, we talked about public relations yesterday. We said it is important to always come out, uh, speak positive about the organization, defend the organization against these media scandals, at least to make people forget and be able to move on. Yeah, so that's that's very very important. So we could go on and on in terms of these medical errors and malpractices. We could go on and on and on. There are quite a number, but we have tried to mention the key ones and given a number of examples. Now, we want to look at crisis management stages or crisis communication strategies. So, We have quite a number of them. The first one is we could be having a pre-crisis phase. And in this particular phase is where we have signal detection, where you need to be alert on the warning signs, potential crisis scenarios. I'm sure by the time COVID-19 was being announced as having the first person in the world, there must be some signal that they have seen. When these pandemics happen, some of them you can detect a signal. Maybe there are some tests that have been done that are maybe unearthing a problem. And also preparation and prevention, develop crisis management plans. So you need to come up with a plan. A plan is just a way that you plan to deal with the crisis. Protocols, procedures for now you are going to be able to deal with it. So that one is the pre-crisis phase. So the key concentration is getting to know the signs of a particular crisis. I did give examples of pandemics, disease outbreaks, natural disasters, and other emergencies. Then from there, we have during the crisis phase, we could have containment and damage limitation. So in this particular phase, we are supposed to take immediate actions to minimize the impact of the crisis. So immediately we swing into action and see what is it that we are going to do. Because when we begin to control it at that early stage, it becomes easy to manage it. But when we wait for it now to spread and escalate, now it puts us into a major problem. And then also effective crisis communication. We are able to provide timely and accurate information. That is very key, and that's why I gave example of COVID-19 and how WHO were doing it. We need to have as regular communication as possible, and also show empathy, concern, and take responsibility. When you are showing empathy, it simply means you are resonating with those that maybe have suffered the crisis. You are resonating with those that have suffered maybe a disease like COVID-19 and other forms of outbreaks. So show concern. I remember during the COVID period, governments, like for example, the government of Kenya, part of showing concern to its citizen was to do away with certain taxes for a particular period of time. Yeah, because it was a difficult season economically. And I'm sure different governments did different things to show concern and to tell the citizens that we are together in this particular crisis. So that's very, very important to be able to note and understand. Then also, you need to take responsibility as an organization, as the government, and so on. And then we have the post-crisis phase where we have recovery, resume normal activities and operations after the crisis. So now most countries are here or have already moved away from here. Now everything is going back to normal. So now we are having conversations around the El Nino. So what are governments doing? What are countries doing? So at some point we will still also recover from whatever situations that we are going to experience and resume our normal operations. So this is common for any kind of crisis. And also learning, we can now be able to reflect on the crisis, identify various lessons that have been learned, and also we need to make improvements for the future. Yeah, so that's very, very important. The aspect of reflection. We need to sit back. We have been able to manage. Of course, when we are doing that, also we are preparing ourselves for other events that might occur in the future. Now, we have what are some of the best practices that we could adopt in crisis communication? What are some of the best practices? Number one, we need to be reactive or proactive. And that simply means we need to have anticipation of potential crises and have contingency plans. Like now we have conversations around El Nino starting. It has started in some places. How many of these countries have prepared themselves? That's a question that we need to ask ourselves now, lest we find ourselves in a crisis. So maybe we need to work on our drainage systems. Maybe we need to work. I have also had governments telling people that those that are living around rivers to begin to clear from there, because you do not know. That is part of being proactive, rather than wait. Excuse me. The El Nino starts, then we now get into problems of reporting deaths and so many other things. So the other one is you need to be transparent and communicate timely. So that is accurate provision of accurate information. You also need to show empathy and responsibility, and also ensure we have two-way forms of communication where you need to engage in dialogue with stakeholders, address their concerns, listen to their feedbacks. Other best practices would be it would involve us engaging various stakeholders within the community. When the reason we are doing that, we want to receive feedback, we want to receive their concerns, we want to receive the expectations of the people that are affected by the crisis, and also take them through the recovery process. Yeah, so most healthcare organizations are going to be able to do this by seeking support, collaboration from other relevant organizations. I'm sure during the COVID-19, there was also a lot of support from other parts of the world, also in terms of financial support, to even try and at least assist countries to get the basic things, the masks, the gloves, the drugs, if any, and so on and so forth. And also, another best practice is to be able to learn from the crisis and improve. So you need to conduct a thorough analysis and evaluation of the crisis and its response, and be able to identify the root cause. And also, from there, you generate the lessons that you have learned, and also the areas for improvement. So that is very key. And also, other strategies, other best practices would also be consistency and coherence. So that means we need to ensure consistency between organizational identity, corporate identity, and also consistency in terms of communication. That's very, very key. Clear messaging, even when it comes to the messaging, it needs to be very clear. Do not give individuals or citizens messages that are scary. You need to give them hope when you are communicating any kind of crisis. And also what we also need to do around that is also we need to ensure transparency and honesty. When you are giving this information, you need to be transparent. If the numbers have surged, just let everybody know that the numbers have surged. Rather than hide the information, and we might be having so many people that have lost their lives. And also in terms of consistency and on areas communication, we could also use multiple communication channels. Not everybody is able to access the information via television. So it is important to have multiple communication and ensure that it's able to work. And also, very, very importantly, we need to repair our reputation. mostly during that season at organizational level, at a country level, the reputation could be damaged. So we need to take steps to rebuild trust, demonstrate organizational changes, and also learn from the crisis. And these particular lessons will be key to take us to the next level. Crisis communication best practices. So we have something we call the 3 R's of crisis communication: regret, responsibility, and remedy. So regret means by making a statement of the sort that we regret that this is happening. And then you also take responsibility as an organization, as a government, and also provide remedy, provide direction on what we are supposed to do or how we are supposed to move forward. We also have another strategy we call the 4 C's of crisis communication, where we need clarity. I've just talked about clarity in terms of messaging. We need consistency. How often are you communicating? And we have said the more you do it regularly, the more you are dealing with panic and anxiety. And also credibility, show compassion, show empathy, and so on and so forth. Then we can also use another best practice of what we call the 5 W's of crisis communication: who, what, when, where is the crisis taking place. You could also give reasons on why we have surge in numbers. Where are the most numbers? We had that being communicated very well based on regions. We could be able to communicate that information. We could also adopt the best practice of what we call the 6 P's of crisis communication. So we need to know the purpose of communication, the people, the perspective of communication, the position, the plan, and the performance. Also, we could adopt the 7 C's one, the context. What is the context of the communication that we are doing? What is the content? Is everything we are saying necessary? Or we are just fumbling words and writing long articles regarding the crisis and not helping anyone? So channel, I've just mentioned that in terms of us also adopting multiple channels depending on who you want to reach. And then we also have contact, we also have collaboration, we also have so collaboration, we had just mentioned it above, where we have just said you need to collaborate with other people and organizations. And also we need some aspect of coordination across government within the organization, and also introduce the element of control. And then we have the 8 A's of crisis communication. So we need to acknowledge, apologize. This one is, we have some similar to the 3 R's that we have just discussed above. So acknowledge that a mistake has taken place, or a crisis has begotten us as a country, as an organization, as a community. And then we go ahead and apologize, accept, address, act. You can also provide advice, provide assurance that everything is going to be okay, and also advance. Yeah, so you can adopt either of these strategies. Each of them is quite okay. It depends on the magnitude of the crisis that we are in. And also, we also have what we call the 9 E's of crisis communication: empathy, engagement. So empathy, we have said, is where you show the people that are supposed to receive this particular information that you resonate with them. You feel the situation that they are in. You feel their problems. And also we can have some different forms of engagement: education, explanation, So you need to educate them on how to do. During that period of COVID-19, the government also invested in running advertisement programs in terms of washing hands, in terms of how to use the mask. That's education, and it's also part of crisis communication and management. And then also explanation. So whatever issues have arisen during the crisis, you need to explain them. Expectations, evaluation, enhancement, extension, and evolution. There are quite a number of things that we can be able to do here. And then also we have the 10 C's of crisis communication, things to do with the situation. So what is the situation of the crisis? Where are we currently? The stakeholders. Stakeholders are simply people that have an interest in maybe a certain crisis. For example, during COVID-19, the stakeholders were the patients, we had the government, we had the WHO, the World Health Organization. The scope, when you talk about scope, you are looking at the aspects of time, the frequency of communication, severity, to what extent has this crisis been able to affect citizens. The speed in which, in terms of response, we need to have the spokesperson. This, for us to be able to manage communication in terms of crisis, we need also to be hearing communication from one point. Sometimes when we are hearing from different people, it's also an element of confusion that might come up. So that's where we have the S on spokesperson. And also story. If we have success stories of people that have healed, we could make them part of our media campaigns. So people will definitely know, oh, so this person had and they are able to come back stronger and better. The other one is provision of support, provision of solutions, and sustainability. Sustainability is simply the ability of something to last or continue to exist. So we can be able to manage a crisis in a way that we move completely from that particular season. We recover and are able to move on. And finally, we have something we call the attribution theory in crisis communication. And when we talk about attribution of responsibility, we are talking about stakeholders where they make attributions regarding the causes of a crisis. So when we think about attribution, then we could have what we call the internal attributions, where crises caused by factors within the organization. So we could be having the major cause of an issue coming from within an organization. And that, of course, would affect or put us in a major crisis. We have had situations where employees within a certain healthcare organization have gone on strike. We can refer to that as internal attribution because it has begun from within. And then we have external attributions. These ones are caused by factors outside the organization. It could be issues related to government policies that people feel they are insufficient or they are not favoring them. So it is key to know that the attribution of responsibility influences stakeholders. They are also going to affect their expectations, their behavior, their perception of the organization. So it is very, very important for us to understand the discussions around crisis communication. Get to know what you need to do in terms of preparedness and planning, in terms of clear and consistent messaging, in terms of transparency, and so on and so forth. And also empathy. You need to have, like I've said, multiple communications. When you are adopting multiple communication, you need to be very keen so that you can be able to reach everyone. So this is key for you to be able to note, and also the aspect of stakeholders. Yeah, so that would bring us to the end of our engagement here. We have had quite a number of discussions, the definition of crisis. We have looked at that. I also gave you some examples of crises that are not part of the slides, but I'm sure you noted them down. Issues to do with pandemics, disease outbreaks, and so on and so forth, and natural disasters. And we